their January meeting at the African Union Summit, heads of state and government made new commitments to speed up the reduction of maternal death and disability in the continent. Joining us now to discuss maternal health and development is Dr. Babatunde Oshimotien. He is the Executive Director of the United Nations Population Fund. Thank you so much for joining us, sir. Take us through, the challenges still on the continent around this question, given the fact that there's so much progress in terms of Africa's economic growth, the democratization dividend. Why are we still struggling on something as essential as health and maternal, health for that matter?
Thank you very much. Africa has the largest burden of maternal deaths in the world. We lose clearly more than 250,000 women every year in this continent due to women giving birth. Now, Africa has made progress. Since 1999, we've reduced the rate of maternal deaths by 41%. But that's not good enough. Every life is precious, and no woman should die giving birth. Mm-hmm. Now, in 2009, African heads of state decided enough was enough and took a decision at the African Union Summit to put together a program that they dubbed the Campaign to Accelerate the Reduction of Maternal Mortality, which is reduction of maternal deaths.
Take us through...
that has caught on because 37 of the 54 countries in Africa has launched this campaign. But what we have found is that whereas there's a political launch, but very little is happening at the operational level. So we still have women dying giving life.
Now,
so what we did on the 27th of January this year is to get heads of states again together. And we had 51 countries represented, 32 at the level of heads of states and governments. And they recommitted themselves to reduction of maternal deaths. Now, specifically by ensuring that operationally on the ground, there are activities to conduct. We at the United Nations Population Fund, we are at the forefront of that, and we are partnering with the African Union to be able to do that. Now
if we look, sorry, can I come in here, Director, can I come in? The challenges around implementation is, of course, not uniquely African. We see that across the world there's political commitment, but the commitment falls down when it comes to operationalizing, these plans. Take us through what heads of state are forwarding as reasons why some of these plans fall flat. Is it a question of a lack of funds? Is it a question of lack of expertise, infrastructure, skills? What are the key drivers of why the plans often are just, on paper and not, in fact, operationalized on the ground where it matters most?
I think it's all of the above. There is not enough investment on the ground for health, and growth in Africa has not been inclusive. So you find that you don't have enough resources for us to do what we have to do on the ground. That's one. The second, of course, is that we have not built the health infrastructure to ensure that we can reach everybody and provide universal access. Mm-hmm. Number three, family planning, which we know works. Family planning reduces maternal deaths by 1/3. It's not universally available to women and girls around Africa. So what we were trying to do with African heads of states is to get them to commit to increasing investments in health and education, investments in infrastructure, and ensuring that we can reach the last mile in giving care to women and girls who require it. And that was what the 27th of January event was all about.
Now, take us through the commitments around investment in health and education. Is there a specific target? Are we asking governments, for example, to spend X amount of GDP or budgets, national budgets, on health provision? If we take a case like South Africa, there's been a huge debate around the National Health Insurance Fund. We've seen South Africa try and plot this out in a fiscus over a period of time. Of course, if your purse is shrunken, the amount of money that you can put in is limited. And of course, there's this big emphasis on growth, which often doesn't take human development into account, of which health is an important thing. Let me ask you specifically, does the UN set actual targets in terms of what kind of percentages need to be committed to health and education to compel governments to put their money where their mouths are?
But there are three things which we recognize at United Nations Population Fund as necessary for effective delivery of care. The first, of course, is health infrastructure. The second is human resources for health. And the third is a social protection floor that ensures that people can access health when they want it. So those three things require investment. And health and education will be seen as investment. And it's investment in people because human capital development is the most important in terms of inclusive growth. So I believe that that's where to drive this. And Africa got together in 2000, 2001 in Abuja and committed, governments in Africa committed to spending at least 15% of their budget on health. Only about 6 of these governments have been able to get to that mark. Mm-hmm. So I believe that an increased investment and strategic investment in health is what is going to make the difference. Now, let me immediately say, it is not about building hospitals or about fancy things like that. It's about making sure that to every pregnant woman, you have a closed skilled attendant. So what we're talking about is ensuring that the primary healthcare system in Africa works, and that there are people who can immediately offer care close to those that need them. There are two big issues we have to care for in Africa, is the maternal deaths that we have and the child deaths we have, all of which are preventable. And we can prevent them using skilled attendants. They don't have to be doctors. Midwives, nurses, and community health workers will make all the difference. And we've seen it happen in countries like Ethiopia, where they've now deployed about 40,000, community health workers to work directly in communities and service the people.
So the emphasis definitely, obviously, there on primary health care, where the tire hits the tar, where communities interface with these services.